Medicos. Good day to all of you. So in today's class on the neuroanatomy, we will be learning about the white matter of the brain. So our learning objectives with respect to the white matter of the brain mainly will be a short introduction about the white matter. Followed by that, we will be actually learning about the classification of the white matter. So that is the fibers. Okay. So the major classification, they are classified into the three types. In that, first, projection fibers. So we will be learning about in detail the internal capsule and its blood supply. Followed by that, we will be actually learning about the commissural fibers. In that, mainly we will be actually concentrating more on the corpus callosum, and then the association fibers. So we will be learning about the various types of the association fibers. Okay, and the respective clinical anatomy appropriate places we will be actually discussing. Now, first of all, coming to the white matter of the brain. So what are white matter of the brain? They are nothing but the axons. If you look at the cerebrum, so it is called, outer surface is called as the cerebral cortex. So the cortex mainly consists of the outer gray matter, and then you are able to see the inner core of white matter. So this type of arrangement or pattern we have seen in the cerebellum itself. Okay, but this white matter gains more important because this only connects all the parts of the brain, and not only that, then it relates to the spinal cord, and from there what happens is the peripheral nerves, they start. So naturally it mainly forms the core of your nervous system. Okay, so they are mainly myelinated axons. Okay, so the myelination is mainly by the uh, oligodendrocyte. Okay, and then you have your astrocytes. Okay, so they are called as the fibrous astrocytes. Um then only very few axons, which are short axons, are unmyelinated. Otherwise, the majority of the axons forming the white matter of the brain are actually, they are myelinated axons. So they arise deep to the gray matter, which I have already mentioned. So along with these axons, you are able to see definitely the blood vessels, which is very important for the survival of these axons. Okay, so otherwise what happens if there is any ischemia or damage to these blood vessels? So these axons will suffer vascular insult, and definitely they will lead to serious consequences. Then, so that is, they are also supported by the glia. As I told you, your astrocytes, microglia are also present. So these fibers, they form bundles or tracts, which are called as the ascending tracts and the descending tracts. So the ascending tracts and the descending tracts, you know very well, they form your pyramidal and extrapyramidal with respect to the descending tracts. And ascending tracts also, we have seen so many tracts. Okay, so your spinothalamic anterior and lateral spinothalamic tract, which is one of the most important, and then we have seen the fasciculus gracilis and cuneatus. So ascending tracts, they don't directly project into the cerebrum. You know very well. First of all, you have the first order neuron. Okay, then from the periphery, that is from your skin or any sense organ, it relays into the posterior horn, Then what happens is the fibers, they cross mostly in the spinal cord and they ascend and they relay in the thalamus. So that also we have seen the thalamus is an important sensory relay center. So that forms the second order, and what projects from the thalamus to the cerebral cortex is actually called as the third order neurons. So again, this rule strictly applies mainly ascending neurons coming from the spinal cord forming the tracts. So there are also other ascending neurons which are actually coming from the cerebellum. So the output of the cerebellum. So they take different routes, mainly through the superior and the inferior cerebellar peduncles. Okay, then you have also other subcortical regions which project to the cortex. From your hypothalamus. You have projections, and also from the deeper nuclei called as the corpus striatum. So that also actually what happens projects to the cerebral cortex as ascending fibers. Now, is it only the tracts which form uh, the white matter? No, there are also other fibers which run transversely running fibers, because tracts mostly they run vertically. So the transversely running fibers are again can be divided into two types, because they will actually run within one hemisphere. Okay, so here you are able to see they are actually running between one hemisphere, only within one hemisphere, and connecting the adjacent cortical areas or sometimes the different cortical areas. And you are also able to see a set of fibers which is actually running from one cerebrum hemisphere to other cerebral hemisphere. So they are actually crossing takes place. Okay, so that is how they are arranged. So what I mean to tell is there are actually vertically running fibers and transverse running fibers. Among the transversely running fibers, they also cross from one cerebral hemisphere to the other cerebral hemisphere. Now, these fibers, these transverse fibers, and you are able to see that the mainly your the vertical fibers, they also intersect. So you are able to see they are somewhat passing in between these the transverse fibers. They also intersect the vertically running fibers. So all these details we will see as the session proceeds. So now coming to the classification of the white matter. So here you are able to see numerous white matters is represented within the cerebral cortex. So three types mainly you come across in the white matter. So what are the three main types of the white matter? First one is the very important is the projection fibers. So here you are able to see the fibers from the cerebral cortex, they actually travel downwards, or from the lower centers from the spinal cord itself, they might travel upwards. So they connect the different areas of your brain, especially very distant areas of the brain. So they are actually called as the projection fibers. So these fibers are your ascending and the descending tracts. The next type of fibers, you call it as the association fibers. So you are able to see here certain fibers, they are running from one end of the cerebral cortex or from the cerebrum to other end, like from frontal to parietal or occipital lobe. Okay, and sometimes they might curve and they also come to the temporal lobe. So like that these fibers within one hemisphere, but they connect the nearby areas of cerebral cortex or very distant areas of cerebral cortex are actually called as the association fibers. So numerous association fibers you are able to see here. So some names you are seeing here is cingulum. This is superior longitudinal fasciculus. This is arcuate fasciculus. So like that certain things you are able to see here. Okay, these fibers are all your projection fibers. See, they are projecting frontostriatal projections, and these are forming your major tracts. Okay, and then you are also able to see the third type of fiber is the commissural fibers. So these cross from one cerebral hemisphere to the other. So you are able to see here they are actually connecting the functional areas of the. So now first we are starting with the projection fibers. So the projection fibers here mainly whenever we talk about the projection fibers, what actually crosses our mind is the internal capsule. So this is very important examination point of view. So as I told you, the projection fibers connect the cortex. Anything below the cortex is actually called as the subcortical areas. And from there to the brainstem and spinal cord, they run. So corticofugal fibers means they run away from the spinal cord. So they are all descending, and corticopetal fibers they run towards the spinal cord. So they form your ascending tracts. Okay, so projection fibers of the neocortex, mainly your internal capsule, this area where you can see large aggregation of fibers. So they are all actually grouped into compact bundle in this area. The internal capsule is a very important structure. But as you trace above, you are able to see they are radiating to the different lobes of the cerebral cortex, and they are actually called as the corona radiata because they are radiating. Okay, so they are mainly the parts of the neocortex. So you know what is neocortex, which forms the major part of the cerebral hemisphere in humans, most well developed in the humans. You also have archicortex and the paleocortex. So mainly your limbic lobe and your olfactory region, olfactory cortex, entorhinal cortex, all those forms the older evolved parts of the cortex, and which is seen in the lower animals they are well developed. Okay, so that is your fibers or projection fibers mainly for the paleo and archicortex is your fornix and fimbriae. So here you are able to see a band of fibers that is actually called as the fornix. So they start from the hippocampal region. Okay, and they project here to your olfactory areas. So mainly concerned with your learning and memory is your fornix. Okay, so with this introduction we will actually move on to uh, the one of the main important projection fiber, that is called internal capsule. So, mainly when we look at the internal capsule, so it is very important. This structure is very important. Why? Because it is actually a compact and curved bundle of the ascending and descending fibers. So both the ascending and descending fibers. So numerous fibers they converge at one point and they pass through this very narrow area. Okay, and that is why this internal capsule gains importance. Okay, so any damage to this internal capsule, mostly because of the vascular lesions, might produce a very widespread effect in our body. Okay, based on the which region, because for example if you take this alone, small part alone, there are numerous fibers actually present there, both ascending and the descending. So here this internal capsule you are able to see here. So mainly fibers, this is mainly showing your motor cortex, your motor tract, but the pattern is the same way. From the cerebral cortex the fibers they pass through the internal capsule and then downwards to the midbrain pons, and finally they relay into the medulla oblongata. Okay, so here they have represented only your motor cortex. Same way you take the sensory cortex or for that matter other lobes of the cerebrum. Naturally, they might pass through this bent structure either in front or behind, and so on. Okay, so now coming to the a situation, so where actually this internal capsule is situated. So here you are able to see it is situated between the caudate nucleus, thalamus, and the lentiform nucleus. So this is your caudate nucleus and this should be your lentiform nucleus and the thalamus. So caudate nucleus and the thalamus medially and lentiform nucleus laterally. So if you take a section, a transverse section of the brain, you are able to see this part, no? So that is your head of the caudate nucleus, body and tail of the caudate nucleus, which is lateral. Medially what you see is the thalamus. So when you just take a section like this transversely, so you're able to see the head of the caudate nucleus, and that posterior expanded part of the thalamus you are able to see behind. So this should be your posterior expanded part of the thalamus, and more laterally you will be able to see this part is your lentiform nucleus, because it is like a lens. Okay, so it consists of two parts, mainly your putamen and the globus pallidus. So putamen laterally and the globus pallidus medially. So this we will be discussing it in the next class with respect to the deep cortical nucleus. Okay, so caudate nucleus, lentiform nucleus and thalamus. So between these three structures only you are able to see this band of white matter, and that is called as the internal capsule. And more laterally you will see the claustrum and then external capsule, and this is your uh, hidden cortex, your insula. Okay, so that should be your insula, which is folded inside because the surrounding areas have overgrown. Okay, so just I'm explaining this for you to get yourself oriented. Okay, so next coming to these, laterally the lentiform nucleus, medially caudate nucleus and the thalamus. So what are the parts? So it has got an anterior limb which is situated between the head of the caudate nucleus and then anteromedial part of the lentiform nucleus. And then you have a posterior limb which is between the thalamus and the posteromedial surface of the lentiform nucleus. Posterior limb is somewhat long as compared to the anterior limb. So you have an anterior limb and you have a posterior limb, and followed by that the other parts are mainly your genu. So the anterior limb and the posterior limb meet at an angle which opens laterally, and that is actually called as the genu of the internal capsule. So genu means bend. Then you have fibers which are passing behind the lentiform nucleus. So these fibers which pass behind the lentiform nucleus is actually called as the retrolentiform, because it is behind the lentiform nucleus. This is posterior limb, and then more posteriorly you see it is actually called as the retrolentiform part. Okay, and then you also have some fibers passing below the lentiform nucleus, and it is called as the sub excuse me, lentiform part. Okay, so anterior limb, genu, then you see the posterior limb, and then the sublentiform and the retrolentiform part. So the sublentiform part. So this should be your lentiform nucleus. It is like a lens. You are able to see biconvex lens. This is your head of the caudate nucleus, and that should be your thalamus. So between these three structures only you are able to see very compact bundle of fibers passing through a narrow space called as your internal capsule. So if you trace the internal capsule above, it radiates to form the corona radiata. Okay, so below the internal capsule, sorry, below the lentiform nucleus, the sublentiform part is present. So if you trace these internal capsule, as I told you just now, that it is actually continuous with the corona radiata. So it is you any way you can take, either the corona radiata is actually becoming condensed as internal capsule with respect to, if you consider it as the descending tracks, or in case of ascending tracks, what happens is the internal capsule fans out to the various lobes of the cerebral hemisphere as corona radiata. So that is one thing. Then below, if you trace the internal capsule, it forms the cerebral peduncles. So that is the crus cerebri of the midbrain. We have seen the anterior most part of the midbrain. We have seen as the crus cerebri, and between the two crus cerebri, we have seen the interpeduncular fossa. So the internal capsule below continues as the crus cerebri. So in that we have seen medial part, intermediate part and lateral part, which mainly consists again your frontopontine, intermediate part mainly your corticonuclear, corticospinal, and more laterally you have the temporo or the parieto-pontine fibers, crus cerebri. Okay, and below that it continues to the pons and all those, and in the medulla, the pyramids are formed. So all it is nothing but these fibers. They actually start from the cerebral cortex as corona radiata, and then they form the internal capsule and they descend as the crus cerebri and go downwards up to the spinal cord. So wherever necessary, they relay and until they reach the destination, they keep traveling downwards. So now, what are the fibers which are present in the internal capsule, especially in the various parts of the internal capsule? Okay, so because what I mean to tell is the various parts are anterior limb, genu, and then what you have is the posterior limb. Anterior limb, genu, and then what you have is the posterior limb. Then you have the retrolentiform and then the sublentiform part. So each part has got both ascending and descending fibers, which we are going to actually list it out. So this is very important. Definitely you should know these fibers which are present in all the parts, because clinically then only you will know which part of the when pertain certain part of the internal capsule is affected, then what would be the effect, what all the fibers will be damaged. So anterior limb descending fibers, mainly you see the frontopontine fibers. Okay, so the frontopontine fibers mainly from the frontal lobe. So they actually can be seen even in the anterior limb genu as well as in the posterior limb. So frontopontine is the descending fiber which can be seen in all three parts of the what do you call the internal capsule. So mainly your frontopontine fibers, and along with it you come across some actually corticostriate fibers. So from the cortex to this nucleus, corpus striatum, which is formed by the caudate nucleus and your mainly your lentiform nucleus. So lentiform nucleus, as I told you, is divided into globus pallidus and putamen. So the caudate and the putamen forms the corpus striatum, because they both are connected by fibers which run through the internal capsule as striation. So that is why it is called as corpus striatum. So frontopontine fibers from the frontal lobe, they which are descending downwards, and the corticostriate fibers. Ascending fibers mainly consist of your anterior thalamic radiation. So this is your large mass of gray matter thalamus, and below that you have the hypothalamus. You're able to see this internal capsule. So the fibers radiate from the thalamus as the anterior thalamic radiations. So they are from the anterior nucleus and also from the medial dorsal nucleus. So they go to the cortex, prefrontal cortex, area 4 and 6. So mainly projecting to the area 4 and 6. So that is mainly consisting of your anterior thalamic radiation, ascending fibers. Then you also fibers from the thalamic nucleus. They will pass through the cingulum. Okay, so cingulate gyrus, they pass via the cingulate gyrus. So you know, last class only we have seen on the medial aspect, you see above the corpus callosum cingulate gyrus. They are actually association fibers, which I will come to it while dealing with the association fibers. Then what other fibers you come across? So as I told you, to the cingulate gyrus, they are present, and then you have seen from the hypothalamus to the orbital surface of the frontal lobe, some fibers they run, they form the median forebrain bundle. So hypothalamus to the orbital surface, they form the median forebrain bundle. Okay, so through that the fibers also pass, ascending fibers from the hypothalamus to the orbital surface. So these are the ascending fibers, and frontopontine and corticostriate are the descending fibers in the anterior limb. Next, coming to the genu of corpus callosum. Okay, so coming to the genu of corpus callosum. So this bent part mainly consists again your frontopontine, and along with it you have the corticonuclear fibers. So they are also called as the corticobulbar fibers. So mainly to the brainstem nuclei. So mainly all the cranial nerve nuclei is passing through the genu. Okay, it is both ipsilateral and contralateral fibers, because cranial nerve nuclei, the supranuclear fibers, they receive from both the cortex. Okay, but there is some exception, especially from the cranial nerve nucleus 7, that is to the lower part of the face, and cranial nerve nucleus innervating the genioglossus. They are only contralateral, not both ipsi and contralateral are actually traveling. Then to the reticular formation, you have the cortico-reticular fibers. So all these are descending fibers. Ascending fibers mainly form your superior thalamic radiation. So you know what is superior thalamic radiation? So mainly ventral, posterior, lateral and ventral posterior medial nucleus, ventral group of nucleus of thalamus, which is projecting to your sensory motor areas. So mainly the sensations, okay, to the sensory cortex, no? So that is actually projected to the through via the superior thalamic radiation. Next, coming to the posterior limb, very, very important with respect to the internal capsule, posterior limb, because it mainly consists of your corticospinal fibers. So these are present in the posterior limb, and see how they are arranged. So mainly to the face is actually present more anteriorly, and then what happens is followed by the trunk and lower limb. So the face fibers are present more anteriorly. Then apart from that, as I told you, frontopontine fibers also will be present, and paretopontine fibers. And with respect to the ascending fibers, again the superior thalamic radiation, the superior thalamic radiation also continues here. Before that, you also have corticorubral to the red nucleus, and to the corpus striatum, corticostriate fibers descending. So ascending superior thalamic radiation from, as I told you, ventral lateral, ventral anterior nucleus of the thalamus. Then you have the fasciculus subthalamicus, that is mainly from your globus pallidus to your subthalamus. Then you also have fasciculus lenticularis. So that is mainly from your globus pallidus to your uh, thalamus. Instead of hypothalamus, here thalamus. Then you have ansa lenticularis. So the ansa lenticularis from the lentiform nucleus to the thalamus. And you also have from the thalamus to the corpus striatum, thalamostriate fibers from the intralaminar and centromedian nucleus of the thalamus. Okay, so just remember, ascending fibers are mainly superior thalamic, and the striate fibers, nigrostriate fibers, as I told you, from the substantia nigra, and fibers from the thalamus and the hypothalamus, which forms your ansa lenticularis and subthalamic fasciculus. Okay, posterior limb is very, very important because it contains superior thalamic radiation as well as the corticospinal fibers. So next, so that is your superior thalamic radiation, which you are able to see, which I have already discussed in the last slide, how it appears. Coming to the retrolentiform part. So mainly this retrolentiform part consists, descending fibers are paretopontine fibers, okay, and occipitopontine. So fibers actually from the parietal lobe and the occipital lobe, they actually pass through the retrolentiform part. With respect to the and from fibers from the visual cortex also, and some fibers from the lateral geniculate body and the superior colliculus also pass via this retrolentiform part. But what is more important in the retrolentiform part is the ascending fibers. Mainly they form the posterior thalamic radiation. So that is mainly from the pulvinar of the thalamus. They project to the occipital cortex. Okay, that is the visual cortex. Okay, so that is your mainly ascending fibers, posterior thalamic radiation from the pulvinar to the occipital cortex, as I told you. And then part of this posterior thalamic radiation consists of your optic radiation. So from the medial geniculate body, where they are projecting to the visual cortex, is actually called as the optic radiation, which is a part of posterior thalamic radiation. Okay, so here you are also able to see some fibers called as the Mayer's loop, that is not on the posterior thalamic radiation. So that comes along the sublentiform part. They are the posteriormost fibers of the retina which are projecting. So as I told you, from pulvinar to occipital lobe, and optic radiation from lateral geniculate body to the visual cortex, mainly your primary visual area, area 17. So you should have know by this time what is area 17, 18, 19, because only in the last lecture we have in detail discussed about the functional areas. Okay, next coming to the next part, that is your sublentiform part. So the sublentiform part, mainly when you look at it, it consists of again descending fibers, mainly temporopontine fibers. So from the temporal lobe, it passes through the sublentiform part, and some of the paretopontine fibers also pass. So mainly it is the temporopontine fibers. With respect to the ascending fibers, inferior thalamic radiation. So thalamic, we have seen anterior, superior, posterior, and now we are seeing the inferior thalamic radiation. So they, from the medial geniculate body, they actually pass as acoustic radiations or auditory radiations to the auditory cortex. Okay, so that is area 41 and 42 is your auditory cortex of the cerebral cortex, forming the auditory radiation. They are passing below this lentiform nucleus, that is called as the sublentiform part. This is your retrolentiform part, passing behind the lentiform nucleus. Posterior thalamic radiation, which also constitute your optic radiation, is present within it. So sublentiform part, mainly your auditory radiations from your medial geniculate body. Okay, and also I told you the Mayer's loop, which contains the fibers from the lower part of the retina, also pass through this. Some amount of these fibers pass through this sublentiform. So now coming to the blood supply of internal capsule, mainly it is very important, because vascular lesions of the internal capsule are very common, and here you are able to see they are supplied mainly by anterior cerebral, middle cerebral, anterior choroidal, and posterior cerebral arteries. So the various parts, anterior limb genu and posterior limb, is supplied by these arteries: anterior, middle, anterior choroidal, and posterior cerebral arteries. So let us see in a bit detail. So the upper part, mainly the upper part of the anterior limb genu and the posterior limb, is supplied by the deep branches of the middle cerebral artery. They are called as the lenticulostriate branches. So which again consist of medial and lateral striate arteries. Okay, so medial and lateral striate artery. So here you are able to see the internal capsule, and that internal capsule is mainly supplied by branches from the middle cerebral arteries. So upper part of the anterior limb, genu and posterior limb is supplied by the middle cerebral artery. So the superficial cortical branches you are able to see ramify on the cortex middle cerebral artery. The deep branches mainly from the medial and lateral striate arteries, of which one of the lateral striate artery is very large and called as the Charcot's artery. So it is also called as the Charcot's artery of cerebral hemorrhage. So most commonly in cerebral hemorrhage, this artery is ruptured. Okay, so that is how they ramify the deep branches, the lenticulostriate branches, which consist of medial and lateral set, of which one of the lateral striate is very large and called as the Charcot's artery. The lower part of the anterior limb and is mainly supplied by the recurrent artery of the humor. So your anterior cerebral artery, which gives a recurrent artery, which will supply your, here you are able to see the internal capsule called as the recurrent artery. It is one of the medial striate branch from the anterior cerebral artery. Then you have other arteries supplying genu directly from the internal carotid artery. So genu will be getting its blood supply from directly internal carotid, and posterior limb mainly from your posterior cerebral artery. Okay, so the posterior cerebral artery mainly will supply branches and from the anterior choroidal artery. So anterior choroidal and posterior cerebral arteries, and the retro and sublentiform part is again from anterior choroidal arteries. Okay, so the anterior choroidal artery you are able to see it is again arising from your internal carotid artery only. So these are the blood vessels which are mainly supplying the internal capsule. So with this, I have completed the internal capsule and the projection fibers. So most importantly, under the projection fibers, I have discussed about the internal capsule. Now we will pass on to the association fibers. So they associate the areas of the cortex within the same cerebral hemispheres, and they can be classified into two types. That is your short association fibers, and other one is the long association fibers. So with respect to the short association fibers, they connect your adjacent areas of the cerebral cortex. Okay, whereas the long association fibers, they also connect within the same area, but what happens is they actually go to the distant areas. They connect from frontal lobe to the occipital or parietal and temporal lobe. So to name the association fibers, first one you are able to see is the cingulum. So deep to the cingulate gyrus, what you are able to see is the cingulum. Okay, so this is actually a curved bundle starting from mainly your para olfactory region. Then, of course, it courses within the cingulate gyrus and follows the corpus callosum. And mainly, it distributes axons. It is a part of your limbic system. So, Papy's circuit. It is called as the Papy's circuit, mainly for your emotional integration. So, the cingulate fibers mainly connect your para olfactory. Your para-olfactory area to your para-hippocampal gyrus, which is seen in the temporal lobe. So that is about the cingulum. So mainly it is a Papy's circuit and the part of the Papy's circuit, and mainly for emotional intelligence. The next what you have, as I told you, so in the Uncus only you have the para-hippocampal gyrus. Yes, the next is your superior longitudinal fasciculus, but before that you are able to see this is actually called as uncus or uncinate fasciculus, a curved bundle of fibers which passes through the stem of the lateral sulcus. So your lateral sulcus is stem will be here, and then only it will divide into anterior, horizontal, ascending and posterior nerves, which can be seen on the superolateral surface. So mainly this connects your motor area of speech 44 45 on the inferior frontal gyrus to the auditory cortex. So this is mainly responsible for transfer of auditory and visual images of speech from the sensory area to the motor speech area, interpretation of the speech. So that is the main function of the uncinate fasciculus. Okay, from your sensory speech area 21 to your motor speech area, it connects. Then next fiber, association fiber, which we are going to see is the superior longitudinal bundle or superior longitudinal fasciculus. So mainly from the frontal lobe, it goes to the occipital lobe and then curves downwards to the temporal lobe. Okay, so curves downwards to the temporal lobe. Okay, so this mainly connects your frontal eye field area 8 FEF, frontal eye field, to the occipital lobe. So visual or voluntary scanning movements of the eye, so these bundles actually connect your visual cortex with the frontal eye field. Then coming to the arcuate fasciculus, as I told you, it is part of a detached part of the superior longitudinal fasciculus. Okay, and again they also connect your motor and sensory speech areas. So next is your inferior longitudinal fasciculus, which you are able to see here. So that is your inferior longitudinal fasciculus, connects your temporal lobe to the occipital lobe. Okay, so posteriorly it runs from the temporal lobe to the occipital pole, and it is situated from the or separated from the lateral posterior horn of the lateral ventricle by the fibers of optic radiation and the tapetum fiber. So I will come to that. You just we will remember it mainly mediates the connection of the parastriate belt with the temporal lobe cortex. Inferior longitudinal fasciculus mainly connects your temporal lobe with the occipital pole. Then you have fronto-occipital sulcus. So this is seen medial to this descending corona radiata fibers, mainly connects your frontal to occipital lobe. So here you are able to see the detached part, your arcuate fasciculus. Okay, so superior longitudinal fasciculus, which is detached, and inferior longitudinal fasciculus, and the fronto-occipital fiber. So that you are able to see here, fronto-occipital fasciculus. So from the frontal lobe to the occipital lobe, you will be seeing. So these are all about the association fibers, mainly your cingulum, and then uncinate fasciculus, superior longitudinal, inferior longitudinal, and then your fronto-occipital fasciculus. So they mainly connect the functional areas which are somewhat have interrelated with each other. So with that I am passing on to the commissural fibers. So the commissural fibers, as I told you, connect one cerebral hemisphere with the other. Okay, so that is the main function of the commissural fibers. So these commissural fibers connect the identical areas of both the cerebral hemispheres, and you are seeing the crossing of the motor fibers, pyramidal decussation. Okay, or crossing in the superior cerebellar peduncle, or you are seeing the fibers of the thalamic anterior spinothalamic tract or lateral spinothalamic tract crossing in the spinal cord. So these fibers which I told you, no, crossing of the tracts, they don't form your commissural fibers. The commissural fiber should connect mainly areas of the two cerebral hemispheres. Only then they can be considered as the commissural fibers. So what are all the commissural fibers which are present? So mainly the main commissural fiber is the corpus callosum, and then you have the anterior commissure, and then you have the posterior commissure, habenular commissure, and the commissure of fornix or hippocampal commissure. Okay, so we will see commissures one by one. So first in detail, now we are going to discuss about the corpus callosum. So on the medial surface you are able to see a thick band of white matter which is called as the corpus callosum. So it is the largest of the commissural fibers, and it is a commissure of the neocortex, whereas your hippocampal commissure is a commissure of the paleocortex. So they mainly has to connect the functional areas of both cerebral cortex, but certain areas are not connected by this corpus callosum. So these exemptions are: one is your visual area, the occipital lobe. Except for a very small region, most of the visual area, there is no connection between the two functional visual areas of the occipital lobe. And also the sensory motor areas of the hands and feet. The sensory motor areas of the hands and feet is also not connected by this corpus callosum fibers. So parts from anterior to posterior, you have the rostrum, and then this bend is called as the genu, and then you have the body, and then the finally small expanded part is actually called as the splenium of corpus callosum. Okay, so these are the four parts: rostrum, genu, body, and splenium of the corpus callosum. So now coming to the situation and their relations. Above, you are able to see this corpus callosum will be covered by a band of gray matter, which is called as the indusium griseum. And you see medial and lateral striae, longitudinal striae on the superior surface. Okay, so even though it is a white matter, the corpus callosum, above it is covered by a band of gray matter called as the indusium griseum, and the medial and lateral striae. So these are all part of your hippocampus. They are displaced, somewhat displaced nuclei, this indusium griseum of the hippocampal formation. So then this surface is related, mainly above surface related to the anterior cerebral artery. So you're able to see the anterior cerebral artery is related to the superior surface, and what overhangs above this is your falx cerebri, because this one hemisphere, the other hemisphere will be there. Between these two, we see the medial longitudinal fissure, and in that only the falx cerebri enters, okay, which consists of your mainly the lower free border as your inferior sagittal sinus. So the other relations, the genu forms the anterior wall of this cavity, the lateral ventricle, which is closed by the septum pellucidum. So the anterior horn, anterior wall of the anterior horn will be formed by the genu, okay, and then roof will be formed by the central part of the lateral ventricle. The roof will be formed by the body of the corpus callosum, and the rostrum mainly forms the floor of the anterior wall, okay, and the the body of the corpus callosum forms the roof of the central part, okay. Then below the corpus callosum, you are able to see the fornix. They are the fibers from the limbic system, hippocampal gyrus, para-hippocampal gyrus, the fornix. But anteriorly, the fornix is separated from the corpus callosum by this septum pellucidum. Okay, but separated anteriorly by the septum pellucidum. So once deep to the septum pellucidum, you are into the lateral ventricle, cavity of the lateral ventricle. Once you are medial to the septum pellucidum, this part is your third ventricle, okay. So these parts form the lateral wall of your third ventricle. So what are the fibers of the corpus callosum? So mainly the fibers from the rostrum, they connect the orbital surface of both the cortex, cerebral cortex, okay, orbital surface, no? The frontal lobe inferior part, you have the orbital surface, and the fibers, they curve like a fork, okay. The fibers, they curve like a fork, and it is called as the forceps minor. So these fibers are actually called as the forceps minor. The anterior most fibers, they curve and called as the forceps minor. Then the fibers from the body connect wide areas, and they intersect with these fibers, no, the corona radiata continuing as the uh, internal capsule. So ascending and descending fibers, they are intercepted by these fibers. So naturally some intersection is taking place between these transverse fibers of the corpus callosum and the corona radiata. Now but as you go near to the posterior splenium part, there are some fibers which are not intersected by this corona radiata, and they form the tapetum. So without intersection, those fibers are called as the tapetum, and these tapetum forms your roof of your posterior horn of the lateral ventricle. Lateral ventricle has got three extensions. One is the anterior horn, other one is the posterior horn, and other one is the inferior horn. So posterior horn extending into the occipital lobe, the roof is mainly formed by this tapetal fibers, which are nothing but uninterrupted fibers by the corona radiata. Okay, so you are able to see that is the tapetal fibers which are not interrupted by this descending or ascending fibers. They form the roof of the posterior horn of the lateral ventricle. Okay, then coming to the most posterior fibers, they again bend fork-like and called as the forceps major. Here it is very small, and that is why it is called as minor. But here they bend very widely and forms a large fork-like fibers called as the forceps major. And these actually connect the occipital lobe, and they are producing a bulge again on the posterior horn. Okay, you're able to see that is forming a bulge, and that is called as the bulb of the posterior horn. So then you also have one more impression in that wall of the posterior horn called as the calcar avis. Again, that is a bulge formed by the calcarine sulcus. So we will discuss that with the lateral horn class. So mainly the parts you have to remember about the forceps minor, then the forceps major, tapetum, and then the bulb of the posterior horn, which is formed by the forceps major fibers. They are creating an impression on the medial wall of the posterior horn. So next, coming to the other commissural fibers, here you are able to see the habenular commissure on the ventral or superior stalk of the pineal gland. So they connect the habenular nucleus of both the sides, and also they also connect the amygdala, the habenular commissure. Okay, so they mainly connect the habenular nucleus, amygdala, and hippocampal cortex. So they are again part of your hippocampal region, limbic system formation. And then the next commissure is what you see is the commissure of fornix. So you are able to see from the parahippocampal gyrus, the alveus fimbriae, and then the fornix, which is your fiber tract of your limbic system. So both the fornix are connected in between by a commissure, which is called as the commissure of fornix. So the fornix will actually come and end in the mammillary body. Okay, column of fornix it is called as, will come and end in the mammillary body. So that is your uncus and parahippocampal gyrus, which you are able to see here. So from here you are able to see the fornix, column of fornix will end the mammillary body, and from the mammillary body fibers project to the thalamus as the mammillothalamic tract. So both the column of fornix are connected in between by the crus of the fornix, or it is also called as the commissure of fornix. So they mainly connect the two limbic system of both sides. Then coming to the anterior commissure, so which you are able to see here, this is actually called as the anterior commissure, seen in the lamina terminalis, immediately below the optic chiasma. Okay, so near to the optic chiasma you see this anterior commissure, sorry, above the optic chiasma, and the fibers has got an anterior part and a posterior part. So anterior part mainly connects your para-olfactory regions. So anterior olfactory nucleus, anterior perforated substance, entorhinal area are all connected by this anterior part, whereas the posterior part mainly connects your temporal lobe of both the sides. Okay, so the temporal lobes of the both the sides are actually connected. It's a part of your neocortex, that is about the anterior commissure. Okay, so then you have the posterior commissure. Here you are able to see the inferior stalk of the pineal gland. What you are able to see is the posterior commissure. So this posterior commissure, mainly the connections are not that much clear. Mainly it connects your pretectal nucleus, your superior colliculus, and the nucleus ceruleus. Okay, so that is about the commissural fibers. Mainly the corpus callosum is very, very important. Followed by that, others are um, your habenular commissure, commissure of fornix, anterior commissure, and posterior commissure. So finally, coming to the clinical aspects, already I told you that the Charcot's artery is called as the artery of cerebral hemorrhage and recurrent artery of Hubner. This is mainly from the anterior cerebral and this is from the middle cerebral. They are mostly involved in hemorrhage. So the artery might rupture, which can produce stroke. So mainly the internal capsule fibers, if the posterior limb they supply is affected, you have contralateral hemiplegia and sensory loss because of the superior thalamic radiation. So this will be widespread, okay, if the whole of the posterior limb is affected. Okay, so that is why the internal capsule gains importance. The blood supply, mainly these arteries are most commonly ruptured in uncontrolled what you call hypertension. Mostly it happens, or sometimes any clot might go and affect these branches, and sometimes all these might lead to vascular insult to this fibers of the internal capsule. Now, congenital absence of corpus callosum is actually called as the split brain, because when you train something with your right hand, the left hand will not be able to perform it, because all the past experiences are mainly stored in one hemisphere, that is your dominant hemisphere, and from there they are projected to the other contralateral side through the corpus callosum. So if the corpus callosum is actually absent, if it's not formed, then you can have a condition called as the split brain condition. Okay, so then you have to train separately the other hand also. So with this I conclude the white matter of the brain, and thank you very much for your patient listening.